Hi, I'm Maggie. I'm a physician assistant at Midwest Breast.
All right, can you tell us some common incision questions?
So, a lot of times patients will call in and they'll be, concerned about what looks normal and what doesn't look normal. And, sometimes they'll want to send us a photo of their incision if they're really concerned, which is an option. But one thing to know is that, it's very common to have some spotting or drainage from your incisions, especially in the first week or two after surgery. You may not, if your glue is intact and it's dry, that's great, that's what we hope for. But the occasional spotting or seeping, again, is nothing to worry about. And it very oftentimes will look like this, where a few drops, gauze pad, maybe some yellowish, brownish oblate. Again, that's very normal, nothing to be concerned about, usually less than the size of a quarter. And you may also have some watery drainage that may soak through the gauze pad, but again, it's more of a watery consistency, nothing too thick. So an example of that would be, again, just watery, maybe like tinged, but this is very normal, nothing to be concerned about. So what would be concerning is if it's really thick, brown, green, kind of more of a snotty consistency. I know that sounds gross, but that would be something that we would want you to call about. And we would, usually start you on some type of antibiotic. But in general, we would just recommend that you cover your incisions with some gauze, preferably a non-stick gauze, so to prevent the gauze pad from kind of pulling on the incision anytime it's changed. We would encourage you to continue to wash those incisions daily with an antibacterial soap like Dial, and to pat it dry, and you can apply a really thin ointment like a Vaseline or a Chlorhexidine to the edges of that incision, and then cover that with the gauze. So the incisions will usually heal in within 7 to 10 days. If there's any minor separation of that incision. Again, if you're ever concerned that something is deeper than a couple millimeters, or you think it's tracking or tunneling anywhere, then definitely call in. But some examples of some very common things that patients send us photos of, and again, we won't show anything graphic, but these are just very common things to watch for. Sometimes you may have a stitch that works its way to the surface and it will just kind of spit out. You may not have even noticed it. It may just come out in your sleep. And it'll leave just a tiny little pinpoint hole, a couple of millimeters wide. There's no redness, nothing to be concerned about here. You just want to keep it clean, wash it, do the Vaseline. This is another thing to watch for. You may get some just reactive redness around some external sutures. This is not infection, nothing to be worried about. And you may get some very superficial separation of the incision at areas of tension where 3 skin edges come together. Again, not infected, maybe kind of whitish there, that's okay. Just wash it with the Dial soap, pat it dry, do the Vaseline, and cover with the non-stick gauze. Something that's a little bit more you may want to just go ahead and call is if you're seeing a little bit more redness around the incision. This is what we call a suture abscess, so where a stitch is kind of working its way to the surface like we talked about earlier. This is what it's going to look like before you have that hole. So here again, just wash it gently, keep doing the ointment like we talked about. Eventually that will express itself. You will get some spotting drainage like we saw earlier. And it may leave a tiny pinpoint hole, but that will heal in 7 to 10 days. So, and finally, redness that's spreading a lot further out, you definitely want to call about this. This is rare, but we would start you on an antibiotic. But if it's spreading, more than just right around a suture base, then go ahead and call. So, I hope this answered some of your most common questions. Again, we always welcome any calls or photos if you want a little bit more feedback.
Can you talk about incision care?
Sure. Okay, so a lot of patients will ask about, can I shower with my drain tubes? And the answer is yes, we do encourage that. But to make life a little bit easier, we provide for you a lanyard in your little, goodie bag at your pre-op visit typically But if you didn't receive one, you can use like a clean shoestring or any type of ribbon, tie the ends together, loop it around your neck, and you can safety pin the drain tubes. There's a loop on that drain. You'll see that in our drain video. That you can safety pin to that lanyard to kind of corral all your drains in one place while you shower, which makes life a little bit easier so you're not trying to hold on or juggle all of those things. So you can feel free again to wash around that drain site. That's fine with that good soapy lather and a clean wash rag. And if your drain sites or any of your incisions ever start feeling kind of dry or irritated, what we recommend is always to use like a Vaseline or petroleum jelly ointment to apply a very thin layer with a Q-tip to those incisions or around the drain site. And that just helps keep those incisions moist and hydrated and helps them heal better. You don't have to go crazy. We don't need a ton of the ointment, but a little dab will do you. So we do recommend just the Vaseline or Aquaphor only. Please avoid using any type of hydrogen peroxide. I hear that a lot from patients, and that's definitely something we want you to avoid for surgical incisions, as that can cause the healthy cells around that tissue to break down as well, which can actually delay your healing. So I know patients think it's a go-to, but it's not good for surgical incisions again. So just use your Dial soap and your Vaseline, and those are your friends during that first 4 weeks after surgery. All right, a few more things I wanted to add as far as hygiene and incisions that we often hear. We want you to only do showers for the first 4 to 6 weeks after surgery. 6 weeks for a DIEP flap, 4 weeks for any other type of surgery generally. We want your incisions to be well healed before you would attempt any bathtubs or swimming pools. Basically anything where you would be submerged in water. We want those incisions to be well healed for several weeks before you attempt that, just to decrease your risk for infection. Also, you may have heard at your pre-op visit about a product called Chlorhexidine, which is a soap that you can buy to use before surgery, for those couple days before surgery, to decrease the bacterial count on the skin. And that is a great thing that you can buy at any pharmacy. It's just over the counter, comes in a little bottle. But again, that's only for before surgery. We don't want you to use it after surgery. It tends to be a little bit too harsh on those surgical incisions. So again, just before surgery for the Chlorhexidine only. And finally, questions about gauze. You only generally need it on your incisions if you're having spotting or drainage. Or to put in the fold of the breast if you have an incision that runs right in that breast fold, just to kind of help wick away any moisture that may want to accumulate there. But in general, if the incisions are dry and you're not having any spotting, then there's no need to have the gauze pad there unless you feel like your bra is rubbing or causing any friction in those areas.